the probability of detecting pancreatic cancer in its early stages is relatively low, especially in the first and second stages. This is because the cancer often spreads quickly, making early detection more challenging. By the third and fourth stages, however, the chances of detecting it increase, though at this point, the disease is typically more advanced. Pancreatic cancer is known for having one of the highest mortality rates, with nearly 90% of cases being diagnosed too late for effective treatment. The main issue with pancreatic cancer is that its symptoms are often subtle or even absent in the early stages. For example, there may be no noticeable lumps or pain when touched, which might otherwise signal the presence of a tumor. This lack of clear symptoms means that by the time the disease is detected, it may have already spread, making it much more difficult to treat. One of the most challenging aspects of pancreatic cancer is that it is difficult to detect early, and by the time symptoms like pain or jaundice become noticeable, the cancer is often in an advanced stage. Pancreatic cancer is among the deadliest types of cancer, known for its high mortality rate and the fact that it often spreads rapidly before detection. It is a particularly aggressive form of cancer, with a prognosis that is usually poor due to the difficulty of early detection and the limited treatment options available. This type of cancer has earned its reputation as a silent killer, largely because it tends to present few symptoms in its early stages, and the symptoms that do appear are often mistaken for those of less serious health issues. Consequently, pancreatic cancer is often diagnosed only after it has progressed to an advanced stage, which greatly reduces the chances of successful treatment. The novel Father, which I read during the IMF crisis, delves into the life of a man who is diagnosed with terminal pancreatic cancer. As the father struggles with the physical and emotional toll of his illness, the story poignantly illustrates the ravaging effects of this disease. His fight against pancreatic cancer serves as a stark reminder of the profound impact this illness has on both the individual and their loved ones. Pancreatic cancer is particularly challenging to detect early on for several reasons. One of the main factors is that it typically doesn't present noticeable symptoms until it has already spread beyond the pancreas. In its early stages, patients may experience vague and nonspecific symptoms such as digestive issues, nausea, abdominal pain, or fatigue, which are often attributed to less serious conditions. These symptoms can be dismissed as a result of stress, poor diet, or other common causes, which means the cancer can continue to grow undetected. By the time more severe symptoms appear, such as jaundice, weight loss, or intense abdominal pain, the cancer may have already metastasized, making it much harder to treat effectively. The pancreas is located deep within the abdomen, behind the stomach and intestines, making it difficult for doctors to detect tumors through physical examination. The organ's location, along with the fact that early symptoms are often subtle, means that by the time patients are diagnosed, the cancer is often in an advanced stage. The most commonly used diagnostic methods, including ultrasound, CT scans, and endoscopy, often miss early-stage tumors, further contributing to late-stage diagnoses. One of the more effective imaging techniques, such as a CT scan or MRI, may still fail to catch small tumors, making early detection a significant challenge. For these reasons, pancreatic cancer is often not diagnosed until it has reached stages 3 or 4, when it has already spread to other organs and lymph nodes. This late detection leaves limited treatment options and significantly reduces survival rates. Despite these challenges, there are certain warning signs that can potentially indicate the presence of pancreatic cancer. Back pain is one of the earliest and most common symptoms. The pain occurs when the growing tumor presses against surrounding nerves in the abdomen, often radiating to the back. However, Back pain is also a common complaint for other conditions, such as muscle strain or herniated discs, which means it's easy to overlook or misdiagnose. If the back pain is persistent and unexplained, it could be a red flag. Another sign to watch for is unexplained weight loss, which is a common symptom of advanced pancreatic cancer. This can happen because the cancer interferes with the body's ability to properly digest food, leading to malnutrition and a significant decrease in body weight. Another potential sign of pancreatic cancer is the sudden onset of diabetes, particularly in people who are over the age of 50 and have no history of diabetes. Pancreatic cancer can disrupt the pancreas's ability to produce insulin, which can lead to the development of new or worsening diabetes. If someone develops diabetes suddenly, or if their blood sugar levels are poorly controlled without an obvious cause, they should consult a doctor. Jaundice, a condition where the skin and eyes turn yellow, is another common sign of pancreatic cancer. It occurs when the tumor blocks the bile duct, preventing bile from being properly processed and leading to a buildup of bilirubin in the bloodstream. Jaundice is often one of the most visible signs of advanced cancer and should prompt immediate medical attention. Other risk factors for developing pancreatic cancer include smoking, obesity, heavy alcohol consumption, and a family history of the disease. Smoking, in particular, is a major risk factor, and studies show that people who smoke are much more likely to develop pancreatic cancer than those who do not. Smoking damages the pancreas and increases the likelihood of tumor formation. As a result, quitting smoking is one of the most important steps individuals can take to reduce their risk. Heavy alcohol use, while still a risk factor, has a less direct association with pancreatic cancer compared to smoking. However, alcohol abuse can lead to chronic pancreatitis, which in turn increases the risk of developing cancer. Maintaining a healthy body weight and eating a balanced diet are also key to reducing the risk of pancreatic cancer. A healthy diet can play a crucial role in lowering the risk of pancreatic cancer. Diets that are high in processed foods, sugars, and unhealthy fats can put a strain on the pancreas, making it more susceptible to cancer. To support pancreatic health, it's important to focus on whole foods that are rich in vitamins, minerals, and fiber, such as fruits, vegetables, and whole grains. These foods provide the nutrients needed for optimal organ function while reducing the burden on the pancreas. Limiting processed sugars and refined carbohydrates is particularly important, as these can lead to unstable blood sugar levels and put additional strain on the pancreas. In addition, regular physical activity can help keep the body in optimal shape, boosting the immune system and helping to prevent cancer. Managing chronic inflammation is also an essential aspect of reducing cancer risk. Inflammation, particularly when it becomes chronic, has been linked to the development of various types of cancer, including pancreatic cancer. Chronic inflammation can result from poor diet, lack of sleep, and high levels of stress. Incorporating anti-inflammatory foods such as fatty fish, leafy greens, nuts, and seeds into one's diet can help manage inflammation. In addition to diet, regular exercise and stress reduction techniques like yoga, meditation, or mindfulness can further help to reduce inflammation, promote immune function, and lower the overall risk of cancer. Oral health is another often overlooked factor that plays a role in reducing the risk of pancreatic cancer. Research has found a connection between poor oral hygiene, particularly gum disease, and an increased risk of pancreatic cancer. The bacteria from the mouth can enter the bloodstream, causing inflammation throughout the body and potentially contributing to the development of cancer. Regular dental checkups, proper brushing and flossing, and maintaining good oral hygiene can reduce this risk and support overall health. Supporting gut health is also important in preventing pancreatic cancer. A healthy gut microbiome plays a crucial role in maintaining a strong immune system and reducing inflammation throughout the body. A diet rich in prebiotics and probiotics can help maintain a balanced gut microbiome, which in turn helps reduce inflammation and supports overall health. Reducing stress and ensuring adequate sleep also play an important role in maintaining gut health and, by extension, lowering cancer risk. In conclusion, pancreatic cancer remains one of the most deadly cancers, largely due to the fact that it is often diagnosed too late for effective treatment. Its subtle symptoms and deep location in the body make early detection difficult, and by the time it is found, the cancer is often in an advanced stage. However, paying attention to warning signs such as unexplained back pain, weight loss, jaundice, or sudden diabetes can help catch the disease earlier. Reducing risk factors such as smoking, maintaining a healthy diet, and managing stress are crucial steps in lowering the likelihood of developing pancreatic cancer. While much more research is needed to improve detection methods and treatment options, taking proactive steps toward a healthy lifestyle can help reduce the risk of this deadly disease. Regular medical checkups, a healthy diet, and early detection are essential in improving the chances of successful treatment and survival.